Hello, everyone. It's Tuesday, June the 2nd. You know, yesterday, being June the 1st, I didn't really tell you this, but it was a reason to celebrate in some ways for me from the standpoint that May was finally over. You know, April was finally over, or March was finally over, because you know, we're very, very hopeful that each day that goes by, and prayerful that each day that goes by we're closer and closer to a drug that will just make this terrible killer just a bad cold. Or even better, we're getting closer and closer each day that goes by to a vaccine that will just stop it in its tracks. So, for many, many good West Virginians, these months of especially March, April, May have been very stressful and very, very difficult on their families and everything. From a standpoint of us and what we're doing here, you know, with no playbook, it's surely not been any fun, but at the same time, it's an honor to be with you and to try to take us through this. I again commend West Virginia in every way, and you, all of our great people, for all this good stuff that you've done, because you've listened, you've been proactive, you've been smart, you've been innovative, you've been all those things that make us be able to produce these good numbers. Now, we had 2 additional deaths in West Virginia. We lost an 80-year-old male in Preston County and a 52-year-old male in Kanawha County. I just don't know what to say. I mean, you know, every state continues to just lose and lose and lose individuals. And, you know, when we lose a 90-plus-year-old individual, you know, we think, well, they had a great life. Well, you know, that's not good enough. You know, it's just, we celebrate all these people and all their lives and all the great West Virginians that we've lost in these 77. And I've said it over and over, but the 77 is surely too many. It's 77 too many. But today, we're losing a 52-year-old male, and that's bad. We're losing an 80-year-old male that brought us, I'm sure, tons and tons of wisdom, as the 52-year-old male, I'm sure, did too. But please remember these people. You know, please let's never let these people become a statistic. You know, so keep them in your thoughts and prayers, and I'm sure I'll promise you to God above that Kathy and I will absolutely do that. And hopefully we'll be able to celebrate at some point in time that we're really through this terrible pandemic and all the trials and tribulations that this thing's put on us. But we got to keep on going. So let me read to you just this. This is week 6 of our West Virginia Strong, the Comeback Reopening Plan. A round of reopenings begins on Friday, June the 5th. And you see there that we're going to be opening up our movie theaters and our casinos with guidances that are available on my website. Before I go any further with just more updates of things that we have, because I don't have a big list today, I want to announce really something really good in that being a new business that is really expanding and coming to West Virginia, and I'm going to read to you, but today I am proud to announce that Amstead Industries has recently become the majority owner of Advanced Graphite Materials located in Clarksburg. Amstead Industries will expand the production of synthetic graphite at the existing manufacturing facility, enabling U.S. companies to access domestic high-grade graphite material for the use in products such as electricity, or electric vehicle batteries and missile systems, and just on and on. They're going to retain the 140 jobs that are there and plan to steadily increase that capacity. The investment in West Virginia is naturally unbelievable news. Amstead Industries brings more than 100 years of global manufacturing excellence to our state. They are making a statement to the world that West Virginia is on the move and is an excellent place to do business and manufacture products. This new venture ensures a domestic supply chain, and that's so important, a domestic supply chain, for synthetic graphite, for critical sectors of the U.S. economy. Amstead plans to be fully integrated, to be the first fully integrated producer of anode-grade materials based in the United States. Now, the bottom line of the whole this thing, the way I see it, is just this. We're going to save 140 jobs. We're going to grow a whole lot more jobs. We're going to let the world know that West Virginia is the place for manufacturing and everything, and we're going to have a domestic supply in this country that is so important instead of depending upon others throughout all the rest of the world, and we know what that's been like in this pandemic. So today we want to celebrate this great company coming. There's been a lot of people that have put a lot of licks in, from our Commerce Department to our legislatures to everyone that's made this a reality, and today it is a reality. And so I just want to use this platform to salute these people and thank them for coming and all the great work that they're going to do. So it's really good stuff, and I'm really happy that that all this is, that this is happening today, because, in all this you don't maybe have anywhere close to enough good news. But I want to announce again that we're continuing to do our free testing. We're in McDowell County, Ohio County, and Harrison counties on Friday and Saturday. And this optional testing naturally will be free. It'll be to all residents in those counties, even if you don't have any symptoms. We encourage you like crazy to go out and get tested. Especially we're trying to drill down and look at our minority communities and everything, and see if we can do more and more to help there. And the DHHR and the local health departments and the National Guard will be doing the testing, and what a job they've already done. So take advantage of this, please. Especially if you're, maybe feeling a little bit, not so good, and you're an elderly type person or whatever like that, and, we'd like you to come out, but we really, really want our African American communities to come and be tested, because it just helps us. It'll help you and maybe relieve a lot of anxiety, and it'll be able to help us to be able to help you better. Again, up on our website, as far as our cities and our counties applying for the CARES Act money, we've now received 17 applications. We need to have received 170 applications. So keep applying. Please keep that coming to us and everything. And we'll be pumping the money out just as fast as you get the applications in. And so please just keep doing that. It just puts more and more money in our in the West Virginia economy, and it helps our cities and it helps our counties. So please keep applying. The only other thing, I've got just 2 or 3 little cleanup things. I want to remind you again about the census. I want to ask you to, have some kind of team leaders, community leaders, street leader, whatever it may be. Please get yourself counted. That's gigantically important. And so please get that done. I want to just show you just a second, and this is a to be perfectly honest, it's a little braggadocious, but we received a letter yesterday, from the CDC, and the letter's right here. I've already written on it, already done. We want to continue with our plans and everything, but this letter is urging all states to test all the people in all the nursing homes. Remember, West Virginia, you were the first to do it and everything. And so we ran to the fire. I commend all those that pulled that off and everything, and it's a good thing. So I'm proud of you, West Virginia. Now, as far as our numbers and the graphs today, if we could pull our graphs up real quick. If you'll look up at the top at our recovered cases versus our active cases, we continue to widen. You'll notice the bottom line continues to tilt down just a little bit. Top line continues to grow. It's exactly what we want to see. We're at 1,341 that have recovered. We're at 623 active that we're working, and all that's just moving how it ought to move, and that's really good. If you'll just step down one line there, you'll see our graph where we spiked way up, and that was the Huttonsville prison. And since that time, we've had days of 1.23. Yesterday, I think we had the lowest day that we have ever recovered, ever produced and everything, and that was at 1/5 of 1%. So yesterday was a great day. Our number of positives now, remember we were at like 1.92, which was unbelievable, or 1.91, and that was the lowest. And then with Huttonsville and everything, we moved all the way up to 2.13, and then we turned back down. I think yesterday we were at 2.08. Today we're at 2.03. Good numbers, good numbers. We continue to test more than any state around us. We continue to test more than the national average, based on a percentage basis. Absolutely, West Virginia, you continue to just do it, and so just keep doing it. For crying out loud, you've got to remember, and my last will be, you have to remember that this killer is still right here. It hasn't gone anywhere. We don't have a drug to stop it, and it's still right here. But you're living with it. And absolutely, as we're reopening and everything, you continue to produce the numbers. We came up with a mathematical and a scientific way to measure this. We came up with a way to run to the fire when we had an issue, and we did it. And absolutely, West Virginia, you just continue to make us proud and continue to do all the great stuff you're doing. You are absolutely knocking it out of the park, but please don't drop your guard. Again, how big a deal is it if you go out and you're going to go in a store, a retail store, to buy something? Wear your mask. For crying out loud, just wear your mask. Protect yourself and others around you. You may be in the store for an hour. So what? For crying out loud, wear your mask and everything, and still be concerned. And keep your guard up, and take care of the elderly, and wash your hands. Absolutely, you're doing it. And this thing, all you're going to have to do is put up with this nonsense and everything and all this tough stuff for maybe just a matter of months. Because within a matter of months, we're going to have a medicine. I believe that with all in me. But absolutely, you've got to keep your guard up right now. Because the last thing on earth, and the reality is just as simple as this. Is it not simpler to keep your guard up? Is it not simpler to wear your mask than it would be to standing in a hospital with one of your loved ones, and absolutely they're just hanging on, for life and, for the last maybe breaths of life, compared to just please wear your mask. Take care of the elderly. Take care of yourself and all those around you, and we'll be in great shape. Okay, thank you so much. That's all I've got.
All right, thank you, Governor. Let's first go to Major General Hoyer with the West Virginia National Guard.
Morning. I'd like to highlight 3 areas today. First is an update on some operational activities. Yesterday, we supported the West Virginia State Police with testing for the cadets coming back to the academy. 75 cadets and staff tested. They represented individuals from 24 counties. All tests came back negative, so it was a good news story from the standpoint of supporting our brothers and sisters in the state police so they can do the job that they need to do, but also helping to biopsy across our state by identifying folks from various counties who are not infected and can move forward. Second is we'll be providing PPE to Division of Corrections as they start their intensive testing throughout the corrections system. Continuing to support the testing at Sharp Hospital in support of DHHR. Also preparing for the test lanes that the governor outlined earlier for this weekend on Friday and Saturday. Also want to talk about 2 other areas. One is, unfortunately, we had a member of the National Guard who made some inflammatory comments on social media. Just want to know, again, to reinforce to folks that it's my responsibility as the head of the organization to the governor to make sure when we make mistakes and do things wrong that we take responsibility and take corrective action. We'll be taking the appropriate disciplinary action related to that individual or any others we might find who make inflammatory comments related to protests going on across the nation. Last thing, I want to talk just a little bit about the role of the National Guard because I know there's a lot of questions out there. Our primary mission is to protect and defend the Constitution of the United States and the state of West Virginia and protect the citizens of the state of West Virginia, whether that's going and doing our overseas mission overseas or doing the things that we do here with Hurricane Sandy, the derecho, the water contamination, all the support pieces. I think it's important to understand that early on in this event, the governor has us focused on stabilization of population as one of our primary missions. So focusing on making sure that our healthcare providers, our first responders, and law enforcement personnel have the appropriate PPE, supporting the Department of Education and Senior Services, ensuring, and our food banks, and ensuring that our citizens are having the food that they need to sustain themselves. Supporting workforce to make sure that unemployment claims got processed, providing testing support and doing the things we're doing for right now in the Eastern Panhandle, working with businesses to mitigate the spread of the virus going forward. So we'll stay focused on those things. We'll also be prepared, and I'll have regular conversations with Superintendent Cahill of where there might be need for support for the Guard in certain circumstances. But understand, just like the many conversations I still have with my friend Steve Williams, the mayor of Huntington, a great example of how you do things effectively. The mayor asked the governor a couple years ago for assistance from the National Guard. The Guard came in and provided what we call backside support, logistics and other support to allow more officers to get out on the street to engage with population. And I think those are the ways that will work. And should we be required to do other activities to support law enforcement, we'll be prepared to do that. But I think the important thing that the governor pointed out yesterday, just like with our response to the virus itself, our response going forward to the challenges that we've currently faced from the circumstance that occurred in Minnesota is West Virginians are doing things in a very respectful and appropriate manner. And I think the people of West Virginia have great respect for our law enforcement community, our first responders, our National Guard, just as we have the same level of respect for the citizens of the state of West Virginia. And we'll be able to move forward in the appropriate manner, and as the governor pointed out, be the beacon and the light for the rest of the country. Thank you.
Thank you, General. Next, we'll go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. I'd like to comment on 2 areas. First of all, we've all given shout outs to the National Guard and the amazing job that they do, but I want to also give a shout out to DHHR and to the amazing job that they do. Secretary Crouch, Commissioner Slemp, Jeremiah Samples, other people on the team, as well as our county health officers and local health departments. They're really doing an extraordinary job for our state. And again, getting a backstage view of this, I really appreciate the great heart and soul that they put into all they do to try to protect our citizens and help people live great lives in West Virginia. But also during this pandemic, they have really stepped up and taking huge amounts of responsibility that people sometimes don't see. So kudos to a great team and a great job there. The second thing is I want to talk about some recent data that's coming out that I think does have some relevance for what we're seeing in West Virginia. So it's becoming more clear that instead of everybody who's infected with COVID-19 equally spreading the virus to other people, there is a subgroup, a group of what are being called super spreaders that are more important in spreading than others. And there's a measure for this. We've talked about R0, which is the reproduction rate, how many people a single infected person will infect. But there's also another measure called the Dispersion Factor. And that really talks about how many people are actually, what percent of the people infected are actually infecting other people. And it turns out that now in studies that are being done around the world, it appears that as few as 1% of people may be responsible for up to 70 or 80% of the spread, but more consistently, between 10 and 20% of people are responsible for 80% of the spread. Interestingly, 70% of people don't appear to spread at all. And why that's relevant is because we know that people that are immediately pre-symptomatic, that will have symptoms, or in the very first part of their symptoms, generally have the highest viral loads and can spread. And this is really a point that I think is super important for people to realize. If you feel sick, or if you just have a cold-like symptoms that are new for you, then stay home. Stay in your family, because this may be a time, if you are infected with COVID-19, that you can spread to other people. And that's really important. It also gives us reason to want to have folks wear masks, because when we're out, then if we are not cognizant, if we're not aware that we're infected, if we're a super spreader, could spread to a lot of people. And in South Korea, one person led to thousands of people being infected. In Hong Kong, one person led to 300 people being infected. And what's really important about this is Japan has come up, and again, they're a country of 127 million that's had less than 1,000 deaths from COVID-19. And they say the secret is really three things. And it's really avoiding closed spaces. So being inside without masks, without protection, and without being spaced. It's having close contact. So it's exposing somebody or being exposed to the same people consistently for over 15 or 30 minutes, and it's being in crowds. And so as we start to help people understand how you can protect yourself and others, then we've talked about face masks, but also think about these 3 C's, which is try to avoid closed spaces with a lot of other people where you're really just connecting to a few, or you're exposed in a continuous way. So West Virginia, you're doing great, but it's really important for us to realize that as we start to really protect other people, let's add these 3 C's. And let's also add the idea that if you don't feel well, then stay in, stay away from other people in case you could be infected. As the governor said, we have plenty of opportunity for testing. So thank you so much.
All right, thank you, Dr. Marsh. Next, we'll go to the West Virginia DHHR with Secretary Bill Crouch and Dr. Kathy Slemp.
Hello, everyone. Good morning. We want to talk about contact tracing in just a second, since we had a question about that yesterday. We are training people constantly in terms of being contact tracers. The range of individuals we're going to need, I think there's been some discussion about that, so I wanted to kind of clear that up. We have about 208 individuals right now that we can use that are trained to do contact tracing. That's kind of the range we're looking at in terms of of how we're doing right now in terms of the amount of testing we're doing. Of course, the governor's asked us to increase testing, and we're doing that all over the state as quickly as we can. The other numbers that may be out there that you may have heard have to do with kind of a low surge range and a high surge range. So low surge is really about 240, and the very high surge is actually 540. So those numbers we don't think we'll get to, don't think we'll need, but we're constantly training people and looking at our numbers and following the data. So we're in pretty good shape right now. We're again moving quickly to train more people, but we're also doing more testing. So we're training folks to keep up with the testing at this point. Testing again is limited sometimes in terms of immediate availability of test kits and supplies. So we'll be getting around other areas of the state as soon as we can. So that's all I have.
And I'd like to also add, with our community-based testing, this has been a real opportunity to see what's happening in communities and to reach folks who we may not otherwise be always reaching. And so we have been focusing, as you know, on our minority population around African-American communities, and that's really a critical piece with the disparities that we see. But I also want to really encourage other minority populations to also come access that testing, especially our Hispanic community. Our homeless population, others that may not always be linking into healthcare systems traditionally, to really come and take advantage of that, and for those that work with them to help support that occurring. So encouraging those folks to also attend. Thanks.
All right, thank you both. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. The first questioner we have today is Mark Curtis with Nexstar Media. All right, looks like we're having trouble connecting to Mark. We'll come back. How about David Beard?
I'm here.
Oh,
I'm here.
Mark's here. Mark's here.
Sorry about that. Little technical problem. I'm just trying to get an update on the situation in Huntinsville, and I was listening on a delay, so you may have mentioned it. But would you assess the situation in Randolph County now as contained? I see there's 119 inmates, and all the tests are completed, so I don't think we're expecting any more inmates. But how many workers in the prison were affected? And again, do you believe you've contained the situation in Randolph County?
I think Secretary Crouch, you guys are going to have to take that.
Yes, sir, Governor. I think Kathy has the latest information on that.
I don't have the latest numbers. The number of staff the other day it was 8, I believe. We'll have to double check the final numbers. It's a few. We have been doing community-based testing, and as of yesterday, with 70% of the results in there, they had been all negative. We're getting the final results with that one as well, so we'll have more to come. But it looks like it's primarily among the facility itself, within the facility is what we know so far. And of course, all of those employees that are involved, we do the routine normal contact tracing and community contacts and follow-up as well.
All right, thank you, Mark. Next, we'll go to David Beard with the Dominion Post.
Hi. People have asked me about summer youth camps. Those are obviously big gatherings with a lot of close contact. I just wondered if, and I don't think they've been mentioned in your plans yet, have you had discussions about that? Are they somewhere down the road on your radar? Thanks.
David, we absolutely have had a lot of discussions about it. We're, all of those are absolutely under consideration right now. I hope we'll have some announcements on that very soon. We totally understand the situation, that there's a lot of summer camps and youth camps and Bible schools and things like that we want our kids to be able to enjoy and everything, and we're trying to draft some level of guidelines and things like that to where we can allow that to go forward. But we haven't quite gotten it all put together, but we're well aware that lots and lots of calls are coming to us, or lots and lots of discussion. We had a big discussion about this yesterday, and we'll continue to have those discussions until we can get to the end of this.
All right, thank you, David. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Thank you. This is Kenny Bass with Channel 8 and Fox 11 in Charleston. A question for General Hoyer, and possibly the governor would want to weigh in. General, when you look at the situation that's occurring across the country, And it's kind of a two-parter for you. One, you mentioned that there was a member of the Guard who posted something inflammatory on social media and will be dealt with according to your policies. How exactly do you determine what is inflammatory? Is it a judgment call, or is it something that you guys have social media guidelines where National Guard troops have to follow them pretty strictly, or else they get into the weeds? And secondly, even though we haven't seen, thankfully, the violence and problems that other areas of the country have seen, do you envision that there would ever be a point where the Guard would be called up with its special trained MPs, military police, etc., that would be assisting law enforcement on the front lines? Or if it gets that bad, would it be something along the logistical support which the Guard offered in Huntington a couple of years ago?
Governor, you okay if I go first?
General, I'm okay if you go first all the time, except this one time. Let me go first right here, okay? Let me kind of tie in the backside. From the social media side and all that kind of stuff, I want our general to weigh in, and I want him to weigh in on the backside here as well. But just think about this, Kenny. You know, first of all, God forbid that we have to get in a situation to where we call in our National Guard because of a bad situation that's going on in West Virginia. Without any question, if we get into a situation to where we're having, you know, violence or looting or damage to our buildings or our businesses and everything, I won't hesitate 1 second, not 1 second, because we can't have that. But let's look at just how good our people have been and how good we are. You know, we've had protests and we've had people exercising their right of their freedom of free speech. And absolutely, they've done it in the way that absolutely, you know, Martin Luther King, all of his family, you know, they have done it in the way that Mr. George Floyd's brother is saying, please don't disgrace my brother, George Floyd. They are doing it in the way to where their voices are truly heard and not drummed out by a bunch of people carrying out violence that have maybe agendas that are nowhere close to this situation. So I can't be more proud. Again, West Virginia has just knocked it out of the park and done exactly the right stuff. And so absolutely, I commend you. I love you. And you know, as we move forward, we surely don't want to condone or even remotely even think about it. It was despicable what, you know, happened to George Floyd. When you've got somebody that's handcuffed and pleading that they can't breathe, it is despicable. And we all know that, and all of our policemen, all of our National Guard, everyone knows that. But that doesn't lead us on to these things that are just, you know, completely away from the respect and the movement to try to improve things and do what's right. And we cannot have the other end of it where we get violence and looting and stuff that's driven by in lots of places, in lots of situations, from people from out of state that are doing stuff just to cause a lot of problems. So now, General, I'll pass back to you, and because I have no idea the guidelines of your discipline and all that kind of stuff, but I'll pass back to you, sir.
So, Kenny, just to follow up on a couple of things, we do have a social media policy, so that'll be used in what we address, and it's pretty clear for members as to what guidelines they should follow related to living the Army and the Air Force values. As far as the support piece, we have tended over the years to focus on what we call the backside, the logistics, or other subject matter expertise support to allow our law enforcement partners to be able to go out and do the important roles that they have. Huntington was a great example of that. When the mayor asked the governor for support, we provided a lot of backside support that allowed more officers to be out and engaging and and working with the citizens of the city of Huntington. We prepare for all missions as best we possibly can, should we need to do those. But I think the other important thing to point out, as I mentioned earlier, early on in this pandemic, when we sat down with the governor and laid out lines of effort that we use in the military to function on, one of the most important lines of effort that he gave us was stabilization of population, which translates into take care of the citizens of West Virginia. So if you're taking care of the citizens see the work that you're doing on their behalf. It leads to a level of mutual respect between them and you as an organization. Same thing with our law enforcement and our first responder community and our medical providers. So I think it goes to the point the governor made. West Virginia is doing great. Let's continue to do great and continue to be respectful of each other, and we will work through this and be a shining example for why businesses and people want to come to West Virginia.
Let me jump. I got to say this, okay? You got to come back to me. Just a few minutes ago, General Hoyer went through just a litany of different things that the Guard is involved in. I mean, I don't know how to say it. I have no idea how to say this other than, because it almost brings tears to my eyes, or maybe it does. But these people, we've had great work, there's no question, from the standpoint of our first responders and DHHR and all of our healthcare communities and everything. And gosh knows what they've done is unbelievable, unbelievable. But if you step back and you listen to what General Hoyer said, and you hear his words about providing meals and backup, in a drug situation down in the Huntington area, and on and on and on, from derecho to flood to everything in the world that they've done. And yet they're sending people all across the globe, and they're protecting our freedoms in this country. And it just goes limitless as to what our National Guard's doing. And so I don't know how you can thank them. I don't know what you can do. If you see them in the restaurant, for crying out loud, and you can afford it, buy their dinner. Do anything and everything just to just say that we love you and appreciate you, because for our first responders, for all the healthcare, the local healthcare, and all the different people that have stepped up and everything, plus our National Guard, please recognize them, because my gosh, what a job, what an incredible job they've done.
All right, thank you, Kenny. Next, we'll go to Paul Mullen with WCBC Radio.
Good morning, Governor. Good morning, panel. Thank you for your time. I want to go back to the Hampshire County Church question I asked at the end of last week, where 14 were infected and tested positive. I want to know where the investigation of that goes from here. Is it a general investigation, or was this the end of contact tracing, that you went back to that church, found somebody had been infected, and then said, hey, we better test everybody in that church? Governor or anybody on the panel want to take that?
I think, Bill, you and Kathy have got to take this, because you know this way better than I.
Sure. This is a situation in which we had a church that had planned appropriately of their how to bring back folks together, and unfortunately did not entirely operationalize. That there were individuals that did not necessarily always operationalize it as folks had planned. It's challenging in these environments. There was spread that occurred within the church. There were, I believe, 7 cases identified with that initially there. And the church has taken actions appropriately there. They are doing the contact investigation and tracing with that. We are not aware of other additional cases directly from that within the facility, but we are watching that as well. And then there are also another small cluster within the community related to folks from dispatchers and first responder community. And again, those are it's small, and those are looking at contact tracing investigations that are being done locally. So I don't have anything suggesting further spread at the moment. We've got focused areas there that are being investigated and looked at, and then we can we'll be following up from there with what we see.
All right, thank you, Paul. Next, we'll go to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. Good to see you this morning. You know, on yesterday's issues with the state budget, I'm wondering, you made reference to additional guidance from federal officials, and that's the only place I've seen or heard it. I wonder if you can point me in some direction to see where that guidance is so I can learn more about it. Also, some legislators seem to think that they are standing at the ready to come in next week, possibly to allocate some money or do something related to filling that budget gap. Yesterday, you said that you don't expect that will be the case, but have they been given any guidance on what their expectation is? Thank you.
Okay, Brad. I don't know anything about any guidance, you know, to have people standing ready to come in next week. I have no idea what that's about because I don't think there's anything to that. You know, we surely stand ready to keep everyone abreast of exactly what's going on. If I could dive into it more and just tell you just this, that you know, we meet every day, every single day, and all the revenue people and myself and everything, we're meeting every day, and they're tracking every aspect of it from a standpoint of a lot of different things, but they're tracking how we're going to be able to, or can we backfill dollars? I mean, you know, can you backfill? And they're going through everything and scrubbing every single department, every single thing that we can possibly do to be able to backfill expenses that were COVID related. You know, monies we've spent, we can take those monies back on the monies that have been sent already into the state on expenses that are COVID related. So we're going through and we're scrubbing everywhere to see that we don't miss a dollar, you know, and these are dollars that we can take back out of the buckets of money that have already been sent to us. Now, in doing so, we continue to bring in more money into the state than what we projected would come in when all this pandemic and all this situation hit. May's a perfect example. We brought in an additional probably $23 million above what we really thought was going to come maybe 3 weeks ago or maybe 6 weeks ago, you know. And when we did our projections in the beginning, we thought that in the month of April and May and June, that we would come up at the end of June with a $500 million deficit. Now, if nothing else had happened, we would have had the legislature in here, you know, way before now, and saying we're going to have to go to the rainy day fund and we're going to have to pull massive amounts of money from the rainy day fund in order to be able to get us to a balanced budget and get us through this year that we're in right now. And next year it could even be worse. Now, what's really happened though is just this. We have whittled and whittled and whittled away at the ability to recoup expenses, at the abilities to use excess dollars that continue to flow into West Virginia. And as far as our cash, from a purely cash standpoint, we felt like we were going to really have a hard time getting to June the 10th. And then we realized, okay, we're good to June the 10th, we can get to June the 15th. And now, without any question whatsoever, unless the whole world blows up tomorrow and everything, we feel certain that we can get to June 30th, cash-wise, without having to do anything as far as the rainy day fund. Now, in addition to that, if we can do that, then we'll start anew, and as we start anew, what's going to happen? Here's exactly what's going to happen. When you roll into July, you're going to have to do exactly how we do on every turnover, you know, at every year and everything. We'll start July off and everything, and then very shortly after that, in the 15th of July, there's going to be substantial income tax money that we deferred from April 15th until July 15th. That's going to get us off and going in 2021, and it's going to absolutely be terrific. So, in other words, what we've done is we've managed 2020 in this terrible situation that's happening right now, and we're going to get through 2020, and 2020 is going to be okay, and we're going to flow right into 2021, and we're going to start off with a jump start that is in a really positive way. But in addition to that, I truly believe that there is going to be even additional guidelines into where that we can go back to the buckets and we can recover, you know, revenues that have been lost by the pandemic, and we can recoup some additional dollars that will flow probably into 2021, because naturally at the end of this month we're in 2021. Now, and the last part of the whole thing is just this, is you got to understand the federal government doesn't give a hoot that our year is ending June the 30th. You know, they don't care about that. I mean, for crying out loud, most people's probably fiscal years are ending at a different time. And so they don't care in any way that our year is ending June the 30th. And so probably what is going to happen here is this may trail along until somewhere out, it may even be August, September, October. It could even be out as late as that, when there is an additional stimulus that comes out or additional guidelines that come out. But irregardless to whether those additionals come out, we're okay. And we're okay right now because of the great work of a lot of people that have put those licks in, especially our revenue department. And so we're okay. And like I said before, and I don't say this braggadociously at all, but this is my wheelhouse. This is right where in my wheelhouse. When you get into the numbers, that's what I love. And so we're okay. And we're going to go forward in a good way.
All right, thanks, Brad. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, my question is regarding next year's school year. I know that on a county level, our county boards of ed are in the process of putting together their reentry plans. They're going to put those out for public comment period. I was wondering, you know, what input from a state level is going into those individual plans? Do we have one overarching plan, or are we going with more of a patchwork from county to county?
Well, Charles, just to tell it like it is, you know, we're right now leaving that with the State Department of Ed. They are simulating all kinds of plans and all kinds of actions and everything. To be perfectly honest, you know, we're kind of sitting back and waiting on them. There's no way on this planet we're going to put our kids or our teachers into a situation that's unsafe. But I surely hope and pray we can get back to school. And so we don't have those plans, you know, completely put together at this time. And we've been dealing with lots of other stuff. We got a few days on that. We'll let the Department of Ed bring us their recommendations and then go from there.
All right, thank you, Charles. Next, we'll go to Emily Allen with West Virginia Public Broadcasting.
Hi, Governor. This is Emily Allen from West Virginia Public Broadcasting. Several healthcare centers and clinics are, they've furloughed employees and they're buckling down even as things are allowed to reopen. How is the state going to support access to healthcare in some of its most sparsely populated communities after all of this is said and done and some hospitals are set to reconcile with cuts and loss of revenue?
Okay, you got to forgive me because I'm not getting all the question and everything, but Dr. Marsh, maybe you could lead off and or Bill, or Dr. Schlemp, maybe I can pick up on the end here.
That sounds good. Maybe I'll start and then let our good folks in DHHR pick up the baton. So I think that's a really important question, and certainly, we know that if we look at the most vulnerable people related to the characteristics of poor health, then it continues to evolve as we get into our less populated areas of the state. And as we know in healthcare, particularly as we ask many of our healthcare systems to take a hold on elective surgeries during the first part of this COVID pandemic because of the concerns of surging and wanting to make sure that we had enough capacity left in our healthcare systems to be able to handle a potential surge in sick people, then we turned down the engine, as the governor has said. And now that we're starting to rev back up again, certainly parts of our healthcare enterprise have started to become busier, but that's not true for all parts. And we know that margins related to the lack of the payment and issues that many people running hospitals know, it's a very challenging business running these kind of enterprises. And I think nationally you're seeing some consolidation of these types of hospitals into bigger systems. So I think that one of our big challenges, and one of the things that I know the governor is very much in favor of, is Secretary Crouch and our good folks in DHHR, as well as the big health systems, is to figure out how we start to do partnering or create networks with the important hospitals, FQHCs, critical access hospitals, and big groups that exist in the less densely populated parts of our state, so that we can bring the right care to them. But as we know, that big academic medical centers like WVU Medicine, or big tertiary quaternary centers like CAMC community centers, or also academic centers like Mountain Health with Marshall, are really expensive to keep up. So we really can't afford to try to replicate those in all areas of the state. So creating a system of healthcare that helps, stabilize and care for people locally as much as possible, but also have that appropriate transport system, telelink system, so that we can help take care of people via telemedicine, do teleecho, which is training via these telelinks, becomes really important, so that we can deliver expert care closer to home, but also be able to move people to these more highly complex environments that are much more expensive to keep up if people need that different level of care. And I'll pass the baton over to our friends in DHHR for any other comments.
Thank you, Clay. I'll just add, hospitals have been through a really tough time. It's been a roller coaster for them in terms of reduction of services through the governor's order, through decisions not to keep staff on that they didn't need because of low census. So we worked with hospitals very closely. We were able to get from CMS, get an exemption from CMS to allow them to receive some payment for patients who really didn't qualify for acute care, who were really long-term care patients, but may have been in the long-term care or in the acute care facility because of COVID. So we've worked with them. The federal government has provided some assistance as well. So they're a great partner for us, and they do a good job in West Virginia of taking care of folks. Staff are being rehired now as census is increasing in facilities. So again, we're there to help them and be partners with them. We appreciate what they do.
I too find it's a really critical issue, an area. I was talking to folks on other topics, but we touched on this as well with our FQHCs last week. And then spent time over the weekend with the West Virginia Academy of Family Physicians, and we began to touch on this issue as well. So I do think it's the critical aspect of how do we not simply increase our hospital capacity, which is happening again and reactivating, where our censuses are coming up there, but in those outpatient settings in communities. It really is critical that people are able to access the chronic care, chronic disease management that they need every day, and the preventive services. I think there's a couple of things. There's been definitely much interest and benefit from telehealth and access along those lines. But we have to recognize that not every at-risk individual can access telehealth or is comfortable with that yet. And so finding ways to make sure we reach vulnerable populations and patients that may not be as comfortable to how do they link them into that and mobilize that. There are also certain things that you just have to be in the provider's office for. And providers are thinking about creative ways of doing these. And the one that I really feel strongly about and we keep speaking to is immunizations and making sure that our kids stay up to date on immunizations. So there are ways to do that safely. It's really critical. The other piece is with our community-based testing, we are trying to partner with providers in the community so that folks that do not have a provider can link into a routine source of care through their FQHC or other primary care centers that are available to them. Thanks.
Jordan, come back to me just one second. I just like to kind of wrap up everything that I'm sure everybody's saying, but first and foremost, let me bulletize it. First and foremost, we know it was really a rocky road for our hospitals. It was really tough stuff because, you lose the elective surgeries, and we had to do that in order to preserve equipment and everything else under the sun. All of a sudden, the hospital becomes on really, really tough times. They don't know about their staff, who to keep, who to let go, all kinds of issues like that and everything. The bottom line is the whole thing. There are stimulus dollars that are flowing to the hospitals. I encourage the hospitals to continue to work with our people in every way that we can get more and more and more of those dollars back to our rural hospitals and our hospitals in our state. We've tried to pump monies into rural hospitals, whether it be Fairmont or no matter, wherever it may be. But the net of the whole thing is just one thing, and here's all there is to it. We are a rural state, and we have got to keep our rural hospitals up and going. And so absolutely, you have my commitment on my watch. Absolutely. I will do anything and everything I can because I truly believe these rural hospitals are our lifeline in our communities. Not only are they massive employers, but for crying out loud, we cannot put somebody in an ambulance and drive them all across this state, and we'll lose people after people, and we've got to keep our rural hospitals going. Now, I know, I get it. I totally get that. And absolutely, you have my commitment in every way that I'll break my neck, back double, triple, to try to keep everything, to try to keep our rural hospitals solid and moving in the right direction.
All right, thank you, Emily. Next, we'll go to Anthony Izaguirre with the AP.
Governor, is there a plan to cover the budget shortfall other than just hoping that the federal government steps in?
Anthony, I don't know how to answer it. I really don't know how to answer it. Anthony, we work on a plan all day, every day. They come and they report that plan to me. I've said it and said it and said it, and I keep saying it. There's an absolute rock solid plan that we absolutely are going to be cash positive. By our cash that we have in hand, we're going to be cash positive on June the 30th. Now, you can't just do that just wishing on Peter Pan and Rainbow Bright. You've got to do it, with our people working it every day. And that's what we do. And if you think that we're sitting around waiting on Peter Pan and Rainbow Bright to come along and make sure this is okay, that's ridiculous. But I have said over and over and over that the government, the guidelines would change. They did. And I really believe there'll be additional guidelines changing, and that's exactly what is happening. But we're not sitting around waiting on Rainbow Bright and Peter Pan to come by. We got this, and we're in good shape. We really appreciate all the legislature and all the interaction that we've had with one another and all that. But in this situation right now, we don't need to dive into the rainy day fund, and absolutely we'll be fine as far as cash when the end of the year, when the clock strikes midnight on June 30th, we're going to be positive cash.
All right, thanks, Anthony. Our last questioner today is Katie Coyne with the Charleston Gazette-Mail.
Hi, Governor. It's been almost a week. It'll be a week tomorrow since we said that we were going to test widespread inmates at the jails, prisons, and I'm assuming that includes juveniles too. We've only seen a handful more tests given in the last week. When is that going to go online, and what can we expect to get from that?
Okay, we, and I'm going to pass this on to Dr. Slimp and Bill Crouch in just a second, but I know we have tested a very significant number now of inmates and or staff and everything, and to my knowledge, we haven't come up with a positive yet. And so, but Secretary Crouch and Dr. Slimp, y'all could add to that, please.
I can speak some to the plans there. Actually, the Department of Corrections, DCR, has really been phenomenal in terms of putting together the plans. They're working with their contractors to do this testing. They've got mechanisms in place to do that. They are rolling it out initially in the Eastern Panhandle. We discussed the importance of looking at that population first. So they are starting that testing already underway there now. There is a rollout plan by date, by facility that's been shared, and so they will be moving around the state with their prisons, the jails, and the juvenile facilities. So those are all laid out. They are doing that with their internal capacity, and we're really impressed how self-sufficient they've been in doing that. Want to support them in any way that we can as they roll it out and accomplish it.
All right, thank you, Katie. Governor, I'll turn it back to you.
Well, I really don't have anything other than to just rehash, and I'll do that very quickly. But first and foremost, to all those that are paying proper respect to Mr. George Floyd and exercising their rights of protest or rights of free speech, I thank you for your behavior and your goodness, and I will promise you that your voices will be duly noted. And I just think it's just another step of just how good West Virginians are. I want to again go back and thank all those at DHHR, all our local health people, all the healthcare community that's done fabulous work beyond belief. First responders and police and fire and on and on and on. And if I forget somebody, well, I surely don't mean to do so, but I can never thank you enough. And the National Guard, I mean, are you kidding me? You just knock it out of the park every day, and you're our backbone. And really and truly, I'll never be able to thank you enough. But please keep all these great West Virginians in your thoughts and prayers. And let's just keep going north, West Virginia, and we're going to get through this. We'll get through this together, and I'm really, really proud to be your governor, and we're going to get there. Thank you so much.